I would talk about this fraud and abuse when I just cover this other part of HIPAA and all that, because we need to think of the concepts that are involved here, and then we see what constitutes a fraud and an abuse. Before that, let's go to HIPAA. As you all know, there are rules everywhere. We have an office for HIPAA, which is the OCR, Office of Civil Rights. Now, to practice as a healthcare provider in US is very risky business. It's not just with the clinical care. Secret of your patients is very much important. So HIPAA, actually, it is a law that was passed in August 21st, 1996. It's also called as Kennedy-Kassebaum Act. In that act, it has established a set of protocols, the rules that needs to be followed, while rendering a healthcare service. So when I say HIPAA, many tend to say like HIPAA. It's not that way. HIPAA, Health Insurance, Portability and Accountability Act. It is portable and accountable. That means portability means transfer of information. Accountability, the person whoever is delivering the care, the people who are all covered by this rule are accountable, held accountable.